Let's listen to an expert Dr. Adnan Ali, who's MD Cardio Physician, Cardio Nair Hospital, Mumbai, for hypertension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart.
I am Dr. Adnan. I am currently working as a cardiologist with BMC.
Doctor, how do we define hypertension and when should we conclude that the person has hypertension?
So hypertension, as we all know in easy terms, if I have to tell you, hypertension is high blood pressure, and clinically if we have to define hypertension, we define as you all know, there are two readings in the blood pressure, the upper one the systolic, the lower one which is the diastolic. So a systolic BP more than 130 or diastolic BP more than 80, we define that the person is hypertensive. But we have to take these readings 6 hours apart, and there it's also important how it is measured. So it is measured in a calm environment when the person is comfortable, not just come running from outside, and in that environment it's measured, and two readings are more than 130 or diastolic more than 80, will conclude that the person is hypertensive.
Thank you. Doctor, has there been a recent increase in the incidence of hypertension and heart attack among young patients? If yes, what could be the underlying cause?
Yes, as we have all seen, there is definitely an increase in the number of heart attacks that very young persons are undergoing, and also increase in the incidence of hypertension in them. There are multiple factors which are responsible for this. All these are metabolic diseases, this hypertension and heart attack. These are multifactorial diseases. So a number of different factors come into play to cause them. Not a single factor is responsible. So we have to focus on the modifiable factors, the factors which we can modify. So like in this case, in youngsters facing hypertension and heart attacks, first thing is the diet. As we all know, recent times our diets have changed for the worse. So we have to cut down on the salt intake, increase fibrous foods, oily foods, as we all know. Then second is lifestyle. As we all know, there is tremendous stress on our youngsters. There is lack of sleep, and there is decrease in physical activity, which is definitely responsible. And third factor is genetics. If you have siblings and your parents have undergone heart attack, you are at high risk and you should definitely be alert. And fourth and very important part is in our urban setup is addictions like smoking, like cigarette smoking is definitely a very important and risk factor, positive risk factor for heart attacks in very young people.
Doctor, what precautions a patient should take along with medications?
So there are 2-3 very important things that we need to know, because medicines, you will go to doctor, medicine will prescribe what other factors. So first is monitoring your blood pressures. Even BMC has run a very good non-communicable disease NCD program they are running, and they are encouraging people to get the sugars and the blood pressure checked. So you should keep monitoring it. ऐसा नहीं कि कभी हमारा BP बढ़ा हुआ आया था, and just don't ignore it. Second factor is compliance. We have seen that hypertension medicine is started, BP is controlled, and the medicine is then discontinued. So that should not be done unless the hypertension is temporary and reversible cause. You should continue your medicine lifelong, and you should stop it only after consultation with a doctor. It is like a spring. Once you let it go, it will bounce back. So you have to keep that in mind. And other things we have just seen in previous questions: modifying our diet, modifying our lifestyle. All these precautions you have to take along with the medications to control the blood pressure.
Thank you, Doctor. Public awareness initiative by Glenmark Pharmaceuticals.